I would love to say that I'm terribly busy and that I'm taking a moment out from my very busy life. But the fact is, I'm on total lockdown at the moment. And if I weren't doing this, I'd be out walking around the building, going 10 laps around the apartment building in which we live, and picking up a pebble at the end of every lap to make sure I only do the 10 and don't get to 11 laps. And that's what I'd be doing if I weren't here. But it's a pleasure to be here, and I do hope that our conference bears some fruit. So look, the idea is the web conference is called Responding to COVID-19, the Situation in Africa. And we hope to have a wide-ranging conversation on the challenges posed to Africa by COVID-19 today, and to take in a number of views from different countries and perspectives. But however, before we begin, and before I go to the guests in Africa and elsewhere, I'd like to make it clear why we are holding this web conference today. Over the last week, we have received reports about the effects of lockdown in African countries. Verifiable eyewitness reports of women who have died in childbirth because they couldn't get to hospital, of patients who can't access medicines for HIV treatment, and of people who are going hungry because they can't get out of their homes to buy food. Some of our panelists are going to speak about these issues today, but firstly, I would like to say it is simply unacceptable that the price of an African life in this situation or in any other situation is cheaper than any other life. So how can we as Africans and Europeans work together to change this situation during COVID-19? How can we come up with big ideas and real lasting changes so that the poorest and the most vulnerable don't continue to suffer the most? I'd encourage you to think about this for over the next while, and for our audience members from Africa to Europe to ask questions and to make comments in this vein. Let me introduce our speakers first of all, before we just go any further. We're delighted to have Lord David Chidgey, the co-chair of the UK All-Party Parliamentary Group on Africa and the author of the report Lessons from Ebola-Affected Communities. Dr. Ciara Conlon, medical doctor working in infectious diseases and member of Access to Medicines Ireland. Sally Hayden, award-winning Irish journalist based in Uganda, covering Uganda, Sudan, and migration issues in Libya. Martha Karua, former Minister for Justice in Kenya, social justice advocate and lawyer who is in Nairobi. Dr. Ouma Oluga, Chief Officer of Health at Nairobi Metropolitan Service in Kenya. Professor Nazarius Mbona Tumwasigye. Professor Naz, I hope I've made at least a decent stab at your name. I hope so. Professor Naz, and we are allowed to call him Professor Naz, is with the Department of Epidemiology and Biostatistics in Makerere University School of Public Health in Uganda. And finally, we have Bidemi Bayode, member of Youth Cafe, who is in Lagos in Nigeria. I will encourage everybody to speak absolutely freely, to let us have your views, your opinions. If you disagree with somebody, you please say so after they have finished their speech or whatever. And if you don't mind bearing with me a moment, I'd like to get something off my chest, what has been bugging me for a while. It's that ghastly creature in the White House who recently announced that Narcissus, was suspending aid to the World Health Organization. He is entitled to do so, of course, and maybe there is criticism of the World Health Organization, but to do it during a pandemic is unconscionable. So I just wanted to get that off my chest. Just to check people and where they are, a couple of the people of our contributors and where they are, let me just call them in very briefly. First of all, Bidemi in Lagos, will you just say hello and tell us how the weather is there? Hello, Bidemi. Bidemi, can you hear me?
Oh, hi everyone. Hello,
Good.
Murphy. Hello, Mike.
Excellent, Bidemi. Nice to have you with us.
Can you hear me?
Good, thank you. We look forward to hearing from you. And just about 2 or 3 miles down the road from where I am is Dr. Ciara Conlon. Ciara, would you like to tell all these people how wonderful the weather is here in Ireland, that we're not all rain and mist? How are you? Tell us how you're getting on.
I'm good, thanks. It's great to be able to connect with you all, and I wish I could zoom to a sunnier climate, but
And Martha in Nairobi, would you just like to say hello and say hello to all the people?
Hi everyone. Today is a rainy day, but we appreciate the rains.
You appreciate the rain. We're trying to get rid of the rain and send some of it down in your direction if we can possibly organize that. Anyway,
We need it for our family.
You need it, absolutely you do. Okay, we'll be coming back to all of you later on for the discussion, but first, let me introduce to you one of our distinguished Irish parliamentarians, recently retired leader of the Labour Party and currently a member of the House, Brendan Howland. Brendan, you're most welcome, and thank you so much for joining in. Can I just throw you a question to start?
Sure.
You have a Minister for Health and a Minister in Finance, and you've worked with the IMF on an emergency bailout for Ireland, which we needed so badly. Can you imagine the odds facing an African government and an African people as they face into the impact of this crisis?
Firstly, greetings from the sunny part of Ireland. I'm talking to you from Wexford in the southeast, and it's blue skies outside and the sun is shining. Actually, my garden could do with a drop of rain. You ask a very profound question. No European government has faced the crisis that currently confronts all of us. I read one commentator this morning talking about corona socialism, because the world has now realized that how dependent we are on one another, that this rugged individualism has taken second place now to our dependence, not only on the supports we have in our health service, on our frontline workers, on the people who collect our rubbish, to ensure that our supermarket shelves are stacked. And that solidarity obviously has to be international, because we can't defeat this virus until it's defeated everywhere. I know that Ireland, for example, has completely changed our economic modelling in the last 3 weeks. I was in charge of finances in Ireland in the last crisis. But this is a different type of crisis, when we literally have stopped our economy, or at least half our economy, and half the workforce has come on the public payroll. That is not possible for a lot of Africa. It's not possible for a lot of the world. We have already deployed 7 billion euros in Ireland in the first phase of dealing with this crisis, and we're borrowing money. We expected to have a surplus this year. We're going to have a significant deficit. We can do that. Africa can't. So the argument that Europeans are making within the European Union for what is called a corona bond, where that we mutualize debt to ensure that everybody has the financial wherewithal to deal with this crisis, has to be globalized. We have to have solidarity bonds available through the IMF or the World Bank to ensure that no country is left without the economic capacity to tackle and defeat this virus.
Very good, yeah, and you do wonder, right enough, how could many of the African and other states survive if they didn't have some sort of financial stimulus? No question. The richer countries are going to do well to survive themselves.
Well, we have to make the argument for that level of solidarity, because I see your friend, the President of the United States' action this morning is to end migration into the United States, pull up the drawbridges. And if we revert to every country acting alone, we will not only impoverish the world, we will never defeat this virus, because until it's wiped out in every country, it poses a threat to all of us. So we have to make, and I think our own organization, AAP, which is the African European Parliamentarians Initiative, which wants to link African and European parliamentarians in common cause, not only on coronavirus, but on a range of other issues. We have to have a loud voice of solidarity now so that there's no Fortress Europe or Fortress Africa or Fortress America. That we don't allow people to pull up a drawbridge and isolate us at a time when mutual support and solidarity was never more needed.
Hear, hear. Brendan, can I ask you to introduce the President, please?
Yeah, it's my privilege to introduce a message from the President of Ireland, Michael D. Higgins, a personal friend of mine, a true humanitarian, an opinion leader, and a real friend of Africa. Uachtarán na hÉireann.
I would so like, first of all, to thank all of those who are working on the front line in Africa. In Ireland, we may be coming out of some of our worst experience through really the cooperation of the public, really respecting that advice of washing our hands, having an etiquette in relation to sneezing, social distancing. But I know very well that such an advice is going to be so difficult in Africa, where you have overcrowding and the periphery of cities, where clean water isn't available, and where, as well as the idea of social isolating, is just simply impossible. And also, of course, the idea that one should stay inside. And if you have a daily economy where one earns the price of one's bread and one's food for the day, it would be really an invitation to starve. We must respond to all of these conditions by realising the particularities of the African situation. And we must do so this time, I think, in a way that will allow African agency, perhaps using African communities to develop the capacities or strengthen the capacities where they are there to deal with their own needs. Isn't this such an illustration too to us of how important basic universal services in health and housing and education are? And if we are to learn from this crisis, it should be that we shift the emphasis from armaments and from the death we are encouraging in the world towards providing universal basic services. I think too this is a great opportunity for Europe. Europe has had a legacy in Africa that it would like to forget, but which Africans have not forgotten. And I think now is an opportunity to make a new beginning, and not only to respond to COVID-19, but also to respond to those structural imbalances that are there. Unfair trade, and then there is, of course, the burden of debt. How can we say that it is right in responding to COVID-19 when some African countries are spending more than 12 times on servicing their debt, as is the case in Angola, than in providing public health? I could go on from one country to another, but unfair trade. Debt cancellation is what we need. It is so totally insufficient to speak of 6 months relief in relation to debt payments. I'm glad that Ireland's unique relationship with the African continent is one of peacekeeping, is one of involvement in education, and we do not have an imperial legacy. And I'm so pleased also that Ireland was the first country to respond to the Secretary-General Guterres' response for a special effort in relation to COVID-19. And we're doing this in a number of different ways. I think Ireland has brought forward this funding to its humanitarian agencies, the NGOs. It has, in addition to that, when you put it all together, and through what we're doing through the Department of Agriculture as well as Foreign Affairs, brought about 46 million into being to help in different ways. But what's important now is that there be flexibility on the ground. There is need for cash on the ground to purchase water in some countries, to purchase fuel for the vehicles in Uganda that will bring people to hospital. It is necessary for that cash to go into flow through the NGOs and to be able to combine, if you like, with the state agencies. We need to be a flexible cooperation on the ground in the interest of the Africans who are our fellow citizens. I do want to say as well that Africa is not a problem or wherever its people. It is the continent of the young. And I think that when we look into the future, It is to Africa we look for new forms of economy and a better relationship between economy and society and ecology and culture. It is in Africa we can achieve equality. We can all benefit for a proper, adequate response to the present situation in Africa, taking account of the special circumstances on the ground now that I have mentioned, shortages of water, overcrowding, the difficulties of isolation, but also committing ourselves to a whole new future for Africa, where 2 billion people will live in 2050, where 17 million young Africans enter the labour force every year. These are sources of hope, and they are sources of renewal, not just for Africa, but for the whole world. I so wish everyone who is working and everyone who will be discussing these issues, I offer them solidarity, but also, as President of Ireland, every support. Barbana, every blessing.
President Michael D. Higgins, who feels very strongly about Africa and its people and its future. Let me go to Professor Naz right now. Professor Naz, you're going to set the scene for us in Uganda, a relatively small, open African country, but one which has enforced the COVID-19 lockdown strictly and swiftly. What have been the major challenges and achievements in taking this approach? And I would also like to ask you, why are women dying in childbirth in Uganda?
Okay, thank you so much. Can I know whether everybody's seeing the slide now?
Yes, I can certainly see it. I'm sure most people can.
Okay, great. Yeah, thanks. You want me to answer your question first, or I go through my slides?
Would you mind awfully just answering the question first?
Okay, great. Sorry, can you repeat it?
The challenges and your achievements in taking the approach of lockdown swiftly and strictly, but also with what we had heard during the week about women dying in childbirth. Would you mind elaborating on that for us?
Yeah, Mike, thank you so much. I want to assure you, yes, there are women actually dying during childbirth. And we've also had cases of women actually delivering on the way to the hospital, and they are walking the hospital, nobody to help them, and then the police, as passes by, actually tries to help these women. So yes, what you are hearing is actually true. So a lot is happening, and I think we are still counting all these events. Yeah, it's a lot, definitely. But I also want to, there are many other challenges which are in these few slides. If you can allow me to just go through these slides and you see them. Is that okay, Mike?
Of course, absolutely, yes.
Thank you so much. Now, in particular, I'm looking at these 5 notable interventions, which they are notable in that they have come up with the BBC and other newspapers. You can see, I'm looking at a situation like Rwanda, Uganda, Kenya, South Africa, Nigeria. So in short, it gives different varying measures of interventions of these in this lockdown time. Well, there are areas, there are countries where there's a curfew, other countries there's no curfew, but all in all, definitely there are different measures people are taking to do these restrictions. Now, next, sorry, I'm trying to get the next slide. Oh, sorry. Okay, good. Now, there are some positive effects. There are several negative effects of this lockdown, but probably let's first look at what could have happened in some of these countries. In Uganda, we've had, you can see the intervention in Uganda, we've somehow, we can say temporarily, we are flattening the curve. We don't know what's going to happen after, short while after, but yes, this is what's happening. And in South Africa, you can see there is some level of positive effect on the lockdown. in Rwanda, yes, there's some positive effect as well. Now in South Africa, maybe you want to know that the scale on the right is in thousands, so it's different from the scale on the left. So that's what you need to know. Now next, yes, a list of challenges. I've said very many challenges. Now you notice that in this antenatal care and immunization in Uganda, since February, we've been registering a downward trend. So, and several other services. Maternal death, there's a rise in maternal death. And and then beyond 12 weeks, we've had some issues with the data. Before Feb, the system was not really capturing the information we need. So that's really another challenge is definitely we have issues of sufficient funds. We have problems of livelihood for the urban poor and others most needed situations. There's either poor access or complete lack of medicines in this facility because all resources, all the effort are really geared towards the prevention of this COVID.
Okay,
now,
thank you. Professor Naz, I'll come back to you later on if you don't mind. We're just a problem with sound there. It's not too easy to hear you. So I would like to stick with Uganda, but thank you so much for the moment. I would like to stick with Uganda and perhaps we could go to Sally Hayden. Sally is in Uganda at the moment and Sally is a reporter and has written some very strong articles about the situation both in Libya and the refugee camps and also in Uganda. Would you like to elaborate, Sally, from your point of view on what Professor Naz was saying?
Yes, sure. Hello, and thank you for having me. So I'm in northern Uganda in Gulu, which is kind of a few hours from the South Sudanese border, and I've been reporting here mainly on the impact on people of this lockdown. As he was saying, there are only 56 cases of coronavirus confirmed in Uganda and no deaths. So at the moment, it does seem like they've been quite successful in preventing it from spreading. Having said that, the government restrictions have been causing a huge number of issues. And I think, like in lots of other parts of the world, they've almost caused a reckoning in some sorts of areas of how people were living before this. So you were talking about maternal deaths. Last week, I met the parents of a 12-year-old boy who died because he couldn't get to hospital. He needed a blood transfusion. What's happened here is that they've banned all public and private transport, and you can only travel if you have a special permit or if it's one of the vehicles that the local authorities are using. And definitely at the start of April, so after this ban came in, and the ban came in with 1 hour notice, so there was very little chance to get prepared for it. The authorities here said they had 5 vehicles, and that was for hundreds of thousands of people, and that includes them tracing the cases, doing sensitization, as they call it, like telling people about coronavirus and bringing people to hospital who had other illnesses. And so what's happened is these numbers aren't being properly measured, but I've been told at least 11 women or unborn babies have died as a result of not being able to get health care. And it seems like a lot of children, and I haven't been able to get full figures on this because they don't exist, but even here I've heard of several cases of children dying, and I met the parents of one who did. And then we have issues like a lot of people live hand to mouth. They've been told that they can't work now because they're not selling foodstuffs. So they're telling me, like, we're going to starve, like what are we supposed to do? We're going to starve if this continues. And then you have things like hundreds of thousands of South Sudanese refugees are in camps close to here. They actually already had their rations cut by 30% on 1st of April because of a World Food Programme shortage. And they're now saying, well, we can't work, we're in lockdown and we don't have food. What are we meant to do? So I do think that this is, it potentially is going to lead to a totally different crisis. And then in Gulu, where I am, they have successfully fought Ebola. in 2000, 2001. And so they're quite good at knowing what you have to do to fight these sorts of diseases. But they said that the big difference this time is that they aren't being given resources. So when they had Ebola, resources from the West came flooding in, teams came flooding in, PPE, everything they needed. This time they say they've been given nothing. And so that, again, that's like a big difference. Like there's very much a sense here that Western countries are all taking care of themselves and not trying to look out for other countries. So yeah, that's just a small portion of what's happening here, but maybe gives you a sense of it.
When you mentioned there about the World Food Programme, I understand that the World Food Programme has diminished in terms of its own contributions to the tune of about 30%. Why is that? What's gone on? Is it back to what you're saying, that the richer countries are now so self-absorbed that they're not sending aid? What happened? I mean, obviously, as you say, people need to get out of their houses and they need to get food. I mean, Imran Khan, the president of Pakistan, has said that lockdown will save a lot of people's lives, but it will also cause a lot of people to die of starvation. So what's happened about the World Food Programme? Why is it down so much?
So what they told me was that it was a funding shortfall. And I guess the problem is, like, I don't know exactly why they have that shortfall, but they told me it's more than $100 million, I think, or maybe 200. But I guess the problem here is that in normal times, they would have done an appeal and made that up. But now, obviously, everybody's focused on coronavirus. So they're not going to be thinking about, World Food Programme rations for refugees. And I think it's worth me saying as well, like, this isn't just about the West. So there have been, the government here basically has brought in restrictions, and a lot of critics say that they're also not considering the vulnerable people. So we have issues here like the security have been beating people up, like actually very regularly. And I went out with the army. I actually witnessed this myself. So there's a curfew at night, which starts at 7 p.m. And the army basically go around and can do whatever they want, or they're not supposed to, the government tells them not to, but they are doing whatever they want to enforce that curfew. And you have issues like street children. So where I am, there are hundreds of street children who have nowhere to go after 7 p.m. And so they're trying to hide to avoid the army. But of course, if they have nowhere to go, they're technically violating the law, even though the law wasn't brought in consideration for them. And then we also have the government here have effectively said that charity is banned, like person-to-person charity is banned, that all charity must go through the government. And so the president said that you can be arrested for attempted murder if you give out food, because that might draw a crowd, which might spread coronavirus. So they're saying everything needs to be funneled through the government. And then we've had 4 top officials from the office of the Prime Minister arrested on corruption charges. And meanwhile, I've been attending the local task force meetings here where they discuss how to help people who need it. They're saying that it's just so slow to get anything approved that you you basically can't do anything immediately at all. So there are also issues around how the government is functioning with this. And having said that, pretty much everybody I speak to say that a lockdown is necessary. They don't want this disease to spread. They think it's going to be terrible, but it's just about considering all the things that go along with that.
You wrote a very harrowing article about refugee camps in Libya. And isn't it the ultimate nightmare that the virus gets into a refugee camp or camps?
Yeah, so again, I'm sure lots of people know that there are refugees, migrants in Libya who are trying to get to Europe and get intercepted at sea by the Libyan Coast Guards, who are backed by the EU actually, and are brought back to detention centres. And some are locked up at the moment. Actually, a lot of them are being released onto the streets. But of course, Libya is in the middle of a war. So you have both a war and then coronavirus, which compounds all the issues. And yeah, again, at the moment, the problem in the detention centres seems to be that food supplies are getting shut down. So they're just not being fed. So the concern for them again at the moment is that they just won't have food and water. But then many people have tuberculosis. You know, if coronavirus got into those centers, then it's going to spread very rapidly and be very destructive. And yeah, once again, it's just coronavirus kind of compounding issues that were already there, and meaning that those issues aren't even going to be addressed for a long time because now we're dealing with coronavirus.
From your position where you are, what measures would you recommend to policymakers and to communities in Europe and in Africa to make positive changes in all these situations? I mean, if you're talking about the money, give the money to the government, but then the government is not going to utilize it either quickly or well, what way do you want to see things change?
I mean, for me, to be honest, I'm a journalist, so I tend not to make policy recommendations. Like, it's not really my place to do that. However, I would just say that, like, taking into account vulnerable people and taking into account all the issues that were already there, like, everything is going to be exacerbated by this, and so that's something to be conscious of. And obviously, as a journalist, it's also concerning because both the media is in crisis, so we might not even be able to get money to report, and then also we can't travel, so there are obviously like a lot of things that aren't even going to get reported in this time. So it's, you know, it's difficult for everybody, but it's just keeping into account like who are the most vulnerable, what might they be experiencing.
Let me go to Lord David Chidgey. Lord Chidgey, you chaired an important report carried out by the British Parliament some years ago called Lessons from Ebola-Affected Communities, which focused on the international community's role during the Ebola response in West Africa. You probably have come across before some of the situations described for us there by Sally. From your previous experience, but can you tell us, please, what were the most important findings from your Ebola report, and how can they be applied to a response to COVID-19?
Good morning. Yes, I'd be delighted to do that. But can I just firstly say how inspirational President Higgins was with his opening remarks, and again, sort of talking to Brendan, it's great to see him in the frame again. It's great to see this initiative from Ireland, it really is. And Sally made some interesting points about the problems that has developed with COVID-19. The important thing to remember, I think, is that when we were dealing with the outcomes of Ebola, the scale of it was just almost minuscule compared to COVID-19. For example, to take up the point you asked me, the epidemic in Ebola in West Africa, it started around 2014, and by 2016, 11,000 people had died. We're talking of hundreds of thousands, millions of people now. The international response to Ebola was in fact very weak, right, compared to the, or as Sally was talking, compared to others. We had a good initiative from the UK. They went into Sierra Leone and found £400 million for medical and technical support. And at that time, we in a British Parliament, in our group, we felt that it was necessary for parliamentarians to take some sort of ownership of the issues, and to give some oversight to what our government was doing in relation to this. And some of the things we found were quite remarkable. In some instances, when we were looking at intervening with the Ebola crisis, there was resistance and at times hostility towards the Ebola responders. Traditional beliefs involving practices such as mourning by holding the dead body of a relative and washing and dressing it in preparation for burial allowed the disease to spread. And foreign aid workers frequently ignored this, and in their rush to save lives, some even tried to tell villagers they must put aside their traditions of culture and family rights. Eventually, and this is fair praise to the WHO, they played a blinder here. They recognized that inadequate engagement with affected communities was a significant obstacle to an effective response to the epidemic. A turning point came when strategies were developed which incorporated community engagement. And it led to a huge uptake of positive practices. And the response efforts were most effective when communities demanded assistance at the local level. I think Sally touched on this quite neatly. The chief finding of the inquiry was that the efforts to curb the outbreak of Ebola in West Africa were most effective when local leaders could lead the demand for assistance from government and donors, and they played an essential leadership role in managing that assistance. Now, interestingly enough, the WHO have reported that back last month, I think it was, they were saying that their work in the DRC, the Democratic Republic of the Congo, in regard to the spread of coronavirus, they're looking at what we did to tackle Ebola in Western Africa as a guide to help in preparation for how to handle coronavirus. The global response to coronavirus, as Sally said, has been very much focused on save ourselves. Understandable human reaction, but not exactly very positive way forward for the world we want to live in. The response has been, particularly in Europe, to require citizens to engage in lockdown and social distancing. But as we've said, Africa is now seen as the epicenter of the epidemic. Many African countries are adopting lockdowns in order to halt the spread of coronavirus. But this is going to be unworkable, as few African countries have the capacity to administer a centralized strategy. People living from day to day, reliant on earning cash in the market for their food, lockdown can be the difference between grinding poverty and, frankly, bleak starvation. The transmission of the virus mechanisms are the same everywhere, but the speed and pattern of the spread varies from place to place. A densely populated township, how familiar that is in Africa, will have a different trajectory to a middle-class suburb or village. The epidemic will spread differently in refugee camps and among nomadic people. As was mentioned earlier, the BBC have done some pretty good work on publicizing these issues. And the key lessons for pandemic response are to act fast and act locally. That's what African countries have to do. With health systems already overstretched, COVID-19 demands an emergency response at scale that begins with governments. Underlying all this, as has been picked up, is the need for funding. In 2011, WHO reported on progress 10 years after the Abuja Declaration on Development Goals. African nations pledged to invest 15% of their annual budget to improve healthcare, and donor nations have been urged to meet the target of 0.7% of their GNP as official development assistance. The final points I really want to make are on this point. By 2011, 10 years after the Abuja Agreement, WHO found that funding targets were being missed domestically and in terms of international assistance. Many African Union countries were struggling to reach health millennium development goals as a result. The key issue was that the actual level of resources available for health needs was far below that what was needed. From this point, WHO argued that in recipient countries, increased priority should be given to health from general budgets. In donor countries, additional funding sources should be encouraged to supplement and not replace traditional bilateral assistance for health. So finally, if I may, with the COVID-19 pandemic sweeping across Africa, the international donors need to act in partnership with African nations to meet the immediate needs and stem the tide of casualties, potentially far, far greater than those from Ebola.
Okay.
Yeah.
So yes, thank you everyone, and thank you for inviting me for this discussion about the COVID-19 response. So first, I will start by looking at the background. I think for me, I'm in a bridge between health workers and also the government. I have done quite a lot of work with health workers unions, where I was the leader until just about a week or so ago. And then now we are also on the other end trying to respond. So we've seen both worlds. And I think for us, beyond the economic situations, beyond the effects of lockdowns or restricted movements, I think within the healthcare system, there are three main challenges. One are the challenges with the health workforce in terms of their numbers, and then the challenge with protecting the health workforce, and then the challenge with responding to non-COVID medical care. And I've seen the same situation in Uganda. Previously, for us here in Nairobi, we've had quite a heavy dependence on private health sector. They take quite a huge chunk of delivery of health services. And what has happened with COVID is that most of the private health facilities have scaled down their operations or closed their routine clinics. And that means that our public health facilities are overwhelmed. So in, for example, 2 hospitals where we were seeing 30 deliveries a day, now we are seeing about 40 deliveries a day with the same health workforce, with the same supply of commodities and with the same infrastructure. So in fact, even as we're talking about distancing in the public or advising within the hospitals, we are struggling a bit because we don't have enough space. So for us in Nairobi, we are a bit challenged in that sense, because with the scale down of private health facilities, we are seeing a bit more a response to health in the public health facilities. But also that comes with the challenge of the referral and with the what we call restricted movement or curfews. Many people do not know who to call when they are having a child that is having asthma or an epileptic one, or even women who want to deliver. So in the last week, we have been really trying to put up measures in that specific response to have, to sort of revive ambulatory response and to advise communities through our community health workforce networks. We have about 5,100 community health workers who are actually members in the community where they live. And we have activated them to spread the message that if anyone is sick or if anyone is needs care urgently, our hospitals are still working. We had previously, I think that was 2 weeks ago, a report of about 2 women who unfortunately one had severe morbidity or lost the child and then went on to be very sick, and then another one lost their life because they were unable to access hospitals in the night. And now we are also working together with the security agencies in what we are calling a multi-agency team. In fact, I have posted across all the border points, I have posted the public health officers for 2 reasons. One is to ensure that anyone who is going to hospital can be allowed to go. And what we are using as a simple measure is, for example, in Africa or in Kenya, generally, the women have a booklet, which we call a maternity booklet. And if they show that booklet, they are allowed to go. And if anyone also has gone to a hospital and you used a taxi or you used any means of transport, all hospitals are writing a note that then can be shown to a security officer so that then we don't have the challenge of restricted movement. Be it as it may, we also are still aware that there may be sections in Nairobi, especially in the informal settlements, that may not be getting our messages. So we are trying to map out community organizations. We are already working with 3 big community organizations. There's one in Nairobi here called Shofco, and then we have Madare Youth Networks, and then we have a few other organizations that we are working with to really get community ownership, but also to integrate this response within the community so that we don't have cases of people, especially for me, is to look at people who really need urgent care, not receiving that care because of the restricted movement or the curfews at night. And then the last issue, of course, is the global supply chain, which is not just affecting commodities for COVID. So for us in Nairobi, being a big epicenter in terms of 200 cases, again, we have a few estates that we have identified as having the big problem. Our greatest response would be to test them But we are also having challenges with test kits, for example. We received a few last week, and we went on a mass testing of a community of 1,000 people. But then after that, it's been very challenging to get the supplies in terms of test kits. But beyond the test kits and the PPEs, there is also a challenge in getting, for example, commodities for hospitals, just the usual commodities to respond. The drugs, most of African countries do not have any manufacturing industries for usual medicines. They don't have manufacturing industries for even beds, hospital beds, or for ventilators, or for anything like that. And that in itself is also a challenge. So if we wanted, for example, to open an ICU today in any of the facilities, there would still be a challenge, including even the anesthetic medicines that are used. So even in that surgery, for example, in cesarean delivery, you still use materials that are not necessarily manufactured in Africa. Most of the supplies either come from China or India. And because of the restricted movements and the cost of expenses, you find that the turnaround time is also a challenge. Be it as it may, so this is really the situation. I think for us, what we've learned, and I think it has been quite discussed here, if this response was to teach us anything, it's about global solidarity. But beyond global solidarity is the issue for us in Africa, beyond trying to look at our own internal response mechanisms and building our social what I call social capital in terms of responding to welfare issues, healthcare, education, housing, water, food, is to also, I think this is the time to really ask for global solidarity. And one of the things I was thinking about from the AU level or from our president's level is to really, and I think the president of Ireland spoke about it, beyond debt cancellation, is also to request, whether it's the UN or at the WHO level, that, for example, manufacturing companies that are mostly based also in the West or in China, that they should just have a mandatory percentage of their supplies coming to Africa, because that's also going to be a problem, not just for COVID issues, but even for ordinary medical equipment or drugs, because one of the things, and I've used this phrase before, that I think the new world war is going to be in medical supplies, and Africa generally is not placed to outbid the rest of the world in terms of ordering, in terms of pricing, in terms of supply chain. So these are real issues that we are dealing with. So for us, I can say that we are taking measures, but then these issues also existed. So we cannot pretend that our infrastructure was good. We cannot pretend that our healthcare was good before. We cannot pretend that we had a good social cover for majority of our population. And lastly, for the Nairobi metropolitan, which I think is the hardest hit in this COVID response, we also have a very huge informal sector population. And together with our community organizations like SHOFCO and the others, we are reaching out to millions in terms of placing, for example, hand washing facilities across, trying to distribute things like sanitizers. But it's of course a challenge, even the way the houses are structured. It's a very big challenge to talk about distancing in those facilities. So crowding, it's our biggest challenge. So how we are responding to that is just to do regular disinfection in those areas. But of course, with regular disinfection, you need a higher workforce, you need more commodities, and also you need a community also that owns that kind of a response. Otherwise, I think the discussion for me, beyond the healthcare response, is to look at the population response. And for us right now is to look at community ownership and community engagement. And that's even for issues like testing. because without the community ownership, and that's something that we have learned here in Nairobi, and perhaps because of my background in organizing and mobilization, that if you take something to a community and they don't own it, like for us in the informal settlement, then it's not good enough. And if they reject it, then you do not have impact even in controlling the pandemic. So we are really trying to engage with community leaders and community organizations, and through our community health strategy, where we have 5,100 community health workers that are linking us up with the communities so that they own the response, and they do not look at it as a government disease, or they do not look at it as some restrictions that are meant to achieve a particular objective other than protecting themselves, so that they are also within their hardships, within their economic hardships, they are also taking measures to protect themselves from the pandemic. Of course, the greatest challenge that we will have is if we were able to do large population testing the way it is being done in other countries, then it would be very much easier to locate everyone who is positive, also locate everyone who is at risk. And then I think that would be able to shorten these restrictions and then open the economy faster. But this is again the challenge that I think is going to happen with Africa, because I know most of the African countries are facing the supply of testing kits, the supply of PPEs, and the supply of just general health commodities. That's my contribution for now, unless there are questions. Thank you.
Well, thank you very much. I was in Nairobi a few years ago, and I remember looking at the hordes of people making their way into the city. And they were walking, most of them. Some of them were in minibuses. So in other words, social distancing is just a pipe dream, really. But do you not get so discouraged when you look at the number of people? I know you must get the local community on side. You must get people to buy into the idea of social distancing. But it is a heck of a task you're taking on, is it not?
It is quite a heck of time. In fact, we have had an experience last Saturday when we were doing, I said mass testing in a population of about 1,000 people. And even during that testing exercise, it was quite a challenge to really keep people having distance. So, and I've visited quite a number of settlements in Nairobi. It's quite a challenge. Structurally, because of the way services are designed, you know, the markets, for example, the way our women they sell groceries, the placement of the houses, it's quite a challenge. So that's why I say that having that in the back of our minds. Of course, we keep reinforcing the message about distancing. We keep reinforcing, and we have now have public health officers who are not just reinforcing, but they are also enforcing the distancing. But I think our greatest response is regular disinfection, because we know the challenge of distancing.
Thank you very much indeed for that contribution. I wonder, could I now go, oh, by the way, for people who have sent in questions, we will try to deal with them later on, but I'd like to get in our contributors beforehand, if that's okay. But please keep the questions coming in, and we'll do our very best to deal with them at a later stage of this conference. Dr. Kira Conlon in Dublin. Kira, could we go to you now? You've just come back from Malawi, and you more or less went straight into a coronavirus ward in a hospital in Dublin. I think you came back 4 or 5 weeks ago. What has the transition been like for you? I'd like you to just tell us a bit about what the situation is in Malawi as you saw it. I know it was kind of pre any major establishment of the virus, but also I'd like to hear from you about your take on working in a coronavirus ward in Dublin.
Hi, thanks very much, Mike, and it's great to be invited on to talk to you all. So yeah, I just came back from Malawi and I was there for 6 months, and I worked across 3 different kind of healthcare facilities, from a district to a community to a rural hospital. So I think I got a pretty good overview of the health system there, and I do know that some of my former colleagues might be tuning in today. So would be great to hear from you during the Q&A, and if not, I'll try and represent you guys as best as I can. So yeah, I've been back for about 4 weeks now, and I've been working on a coronavirus ward in one of the Dublin hospitals. And I suppose, yeah, it's been quite striking, like coming from a country that's extremely resource limited and seeing a lot of patients with conditions that you couldn't do, you know, everything that you would at home. To come to Ireland, where we comparatively, you know, we have access to so much more. I suppose with coronavirus, it's a bit of a funny one because you know, we don't have, even in Ireland, in the developed world, we don't have, you know, access to super fancy treatments yet. They just don't exist yet. But what we do have access to is, you know, we have really good supportive care. We have, you know, oxygen, ICU beds. We have personal protective equipment for staff, you know, even things like paracetamol. And I suppose when I think of Malawi and I think of my time there, and I'm really feeling for my colleagues there now at the moment, because you know, Malawi is a country of 18 million people, and there is 25 ICU beds available and quite limited access to oxygen. And you know, even in some of the hospitals that I worked in, you know, we'd have intermittent access to running water for hand washing and electricity. And so I guess it's a completely different world, and I'm very conscious of what's going on there at the moment. So yesterday there was a strike in Malawi by doctors and nurses, and that was about because they don't have access to personal protective equipment, you know, which they need to protect themselves from coronavirus. Sorry. And I just want to send a message of solidarity to them and support, because you know, they're frontline staff and they're heroes and they're the backbone of their healthcare system. And you know, I hope that issue is resolved quickly for them, so that they can get back to work and, you know, get back to avoid huge knock-on effects in the health system of Malawi. I suppose, like, you know, I've been chatting to a lot of my friends there, my former colleagues, about it, and you know, asking them what they feel the impact is going to be. You know, and I suppose I got a striking message back yesterday. One of the doctors said, you know, Ciara, we hardly survived when the world was normal. So I think that kind of says it all, really, about like a lot of the challenges that they're facing. Another really interesting thing that's going on in Malawi with regards to the lockdown is, you know, so they started introducing restrictions. First of all, they introduced, you know, the schools were closed, and then they limited the number of people on public transport. And even just limiting people on public transport had a huge knock-on effect, because in doing that, the prices went up. And then in doing that, you know, people couldn't get to the marketplace to earn money for the day for their job, or they couldn't get to the tertiary hospitals, or pregnant women were having to pay 3 times as much to get to hospital. So about a week ago, the government of Malawi announced that there was going to be a lockdown, severe restrictions, people having to stay inside. I suppose we're all familiar with the concept by now. But interestingly, that lockdown was challenged in court by the Human Rights Defenders Coalition, and the basis that it would affect the lives of the poor and the vulnerable too much to be feasible. And their challenge actually won. You know, which I think, in my opinion, I think it's a positive thing in a way for Malawi, because, you know, now any measures that they do put in place to contain coronavirus will have to take into account the human rights impact of this, and how it's going to affect ordinary people just trying to earn enough money for the day to buy food. Yeah.
It kind of all comes back once again, Ciara, doesn't it, to the fact that if it's not controlled in Africa, it won't be controlled in the rest of the world. And the fact is, as Brendan Howlin and others were making the point, if people are going to mind ourselves in our country up here, in the Northern Hemisphere maybe, but around the world, when nationalism is becoming more and more rampant, then it's not going to be defeated in Africa. And I suppose, what do we do? I'd love to go back to Lord Chidgey later on if we can get him back. But I tell you what, can I ask you something? And I don't mean to be in any way prurient, Ciara, but you're working in a coronavirus ward now. Is it a horrible situation for a human being to find oneself in, the virus itself?
Yeah, I mean, I really feel for all the patients affected by coronavirus and all their families. And I guess it's being sick is always, you know, so stressful and a tough time. But then I suppose there's the social isolation component of it as well, which makes things all the harder. And you know, it's probably one of the greatest challenges in dealing with this in Ireland. And I guess, you know, I just kind of want to focus on, you know, the fact that I go into work every day, and I do feel very lucky, you know, that I'm putting on my gown, mask and gloves, and I'm thinking of my colleagues in Africa who would, you know, respect those resources so much and use them probably even more efficiently than I do. So just, yeah.
Yeah. All right, Ciara, thanks a million. I'd like now to go to Martha Karua in Kenya, in Nairobi. Can I come to you, Martha, now? It seems calm at the moment there, but what's the national feeling in Kenya today? Do you have a grasp of it yourself? I'm sure you do.
I think first and foremost, we appreciate what the response the government has put in place so far. They're learning on their feet, so every other day something will increase. And I also want to say that Africa generally has so far done well, and we didn't have to reinvent the wheel. We're basically replicating what has been done and seems to work elsewhere, but with modification. Other than Uganda, Rwanda, and South Africa, and maybe one or two others, total lockdowns have not been applied in Africa. In Kenya, it's curfew and restricted movement. What is applied universally is the social distancing, basic hygiene, washing hands, masks, etc. And therefore, Africa is adopting what suits it at the moment. But I would want to agree with the President of Ireland, his very, very appropriate comments about rethinking a new world order where there is fair trade, which will then strengthen Africa, not just to respond to COVID, but also to respond to the issue of basic needs. Because really, this pandemic presents an opportunity for us to rethink provision of basic services and the general idea of the welfare state. Because we are as strong as our weakest link, whether globally or within our nations. And I think that for the global South, it is time for our leadership to focus on the interests of the people rather than self-interest or interests of the big guys, the corporations and the big business. We have a broken health system, not just in Kenya, but in majority of our countries. And I'm seeing this as an opportunity for our governments to overhaul our health systems. Right now, Dr. Oluga may confirm that the national government is trying to coordinate with the 47 counties in Kenya to help them be in a state of preparedness if the health services are overrun by the pandemic. While doing so, why not take the opportunity to ensure that in every county in Kenya, that one county hospital is equipped not only to deal with COVID, but has the necessary infrastructure for diagnostic and treatment of most diseases? Why not take this time to link up the hospitals with ICT so that there can be real-time consultation? I think we are seeing this as a threat, not just to our lives, but also to our livelihoods. because the partial lockdown, the slowdown of activity, and especially economic activity, means less money or no money at all in the pocket. For those who earn daily wages, they went hungry the moment the economy slowed down. And that's 6 weeks ago in Kenya, because that's the end of February. We are still, the government is responding with cushioning the vulnerable, but that help is slow in coming. We have seen Rwanda distributing food using the army. These are things I think governments like in Kenya and others can emulate, but it requires finances. We are in a state of limbo. Nobody knows what tomorrow has. We have so far 270 cases in a period of 6 weeks. We do not know what another 2 weeks will bring, but we pray that the spread is slow. We don't know, because as Dr. Oluga said, we don't have the capability for testing. We have shortage of PPEs in both private and public hospitals. And when the pandemic was peaking in China, Kenya exported some PPEs to China. I hope China is prepared to give back in a big way. I know they have done, but they should do so in a big way. We should not be lacking PPEs if we lent a helping hand to China on the day of need. But to finish off this is to say that we are in a state of anxiety, because we do not know our economy, how long it can hold out. We do not know as households the vulnerable where they can get the next meal, and even the middle class. Our earnings are going to run out. We don't know how long this is going to be. So it is a time of solidarity, not just locally, but internationally, a time to rethink the world again. Thank you.
Thank you so much. May I ask you something just before we let you go? I know that there have been some very positive aspects to Kenya's response, but there have been some negative and tragic ones as well. And I'm referring to the killing of at least 12 people by police who were imposing or enforcing the curfew. If I ask you this, you're a former Minister for Justice and a Human Rights Monitor. Is there a determination in Kenya, do you think, to bring to justice the perpetrators of these killings?
Yes, there is, and our independent policing oversight authority has already ordered some prosecutions, but I must here admit that our security agencies have a culture of brutality, and it is up to the government of the day to give clear and precise instructions that enforcement of the law must be done, respecting the human rights of the people. The joke has been that the police have killed as many people as the pandemic. At one stage, it was more than the pandemic. The government has responded. The president apologized, and the Minister of Health, and they have asked the police to respect the law. But this is again a challenge and also an opportunity for us to reorient our police to do their work respecting human rights of everybody. People are so afraid that 2 women have had to die because they couldn't get to the hospitals for delivery. People fear even explaining to the police that you are in need, because the police may not wait for you to explain. You may be attacked before you even talk. So these are some of the challenges that are there, but they existed before COVID. This is a wake-up call. We must address these issues that bedevil our society.
Thank you very much indeed for that. I would like now to go to Nigeria, to Lagos, and to call in Bidemi Bayode. Bidemi, thank you for joining us. And I just wanted to ask you, you're involved in an organization called Youth Cafe in Africa. Before you tell us about the situation where you are, would you tell us what is Youth Cafe in Africa?
Thank you, Mike. Hello there, everyone. I bring you greetings from Lagos, Nigeria. Firstly, I'd like to extend a note of appreciation to API, the organizers of the webinar event. It means a whole lot to me and the organization that I represent, Youth Cafe, to be a part of such an ingenious concept. Okay, so as our core belief at Youth Cafe, that young people can transform the planet as actors in achievement of sustainable development to tackle the many specific issues facing the youth in our various communities. We target young men and women all around Africa to foster community resilience, propose innovative solutions, drive social progress, enable youth empowerment, and inspire political change. So as we all know, young people are a tremendous and essential asset worth investing in, which is why it is very important not to overlook the influence of the youth during a global crisis such as the COVID-19 pandemic. In Africa alone, young people number 845 million. And at the Youth Cafe, we believe that this gives the world 845 million reasons to work with them. In increasing numbers, young people in Africa are proactively combating the spread of the virus and working to mitigate and address the pandemic's impact.
Bidemi, can I just come in there? What you say, of course, is right, and I suppose sometimes we might tend to forget how tough and resilient people in Africa are, because they have withstood SARS, Ebola, many other things, malaria, TB, AIDS, and they have managed to cope. And as Lord Chigi said earlier on, it's usually, as indeed many of our other contributors have said, it's usually when the local community, the people themselves, are brought in to decide how will we address this problem. But you are confident. But another point, as you were speaking there, I remember reading a statistic that only 2% of the population of Africa are over 65. So when you say the young people are taking an interest, are you finding that your view, the one of taking responsibility and taking control, is shared by many people of around your age?
Yeah, absolutely, Mike. For example, young people are already raising awareness and enhancing connections. We're supporting others and helping health services in the attempts to save lives. We're also helping to safeguard human rights. We have lots of young activists that have taken it upon themselves to make sure that even during this crisis, that there is no infringement on human rights. So we're also trying to address the economic and food security impact of the crisis. There is, however, an increasing demand for more improved conditions, which will see more youths joining the global movement to combat this pandemic and also coming out safer on the other side. Case in point, this involves preserving the rights that youths have to, for example, unlimited access to health insurance coverage, peace, security, and safety, and then definitely employment, decision-making processes in government, education, food security, and welfare. None of these should be negotiable or dispensable because the youths are no longer leaders of tomorrow, but of today. So it's a very classic case is in the Youth Cafe that has worked over the past month on a very astute COVID-19 policy for youths, calling on actors to partner safely and effectively with young people during and after the COVID-19 crisis, also recognizing the value of young people's own actions and their potential to advance the fight against the pandemic, and also understanding the specific impacts the pandemic has and will have on young people, ensuring that COVID-19 related responses uphold young people's human rights and are inclusive of young people's specific needs. Young people around Africa are working together to protect themselves and their households from this pandemic, for example, to support their communities and to prevent the spread of the outbreak.
Okay, Bidemi, thank you. It's very encouraging to hear your views, I must say. Thanks a lot.
Yeah, thank you, Mike.
We will take some questions in a moment. I would love to be able to go back to Lord Chigi. Is it possible to do so? Technically, we lost him there earlier on. And if we're possible to get back to Lord Chigi, I can't make out whether it is or not, but I would love to ask Lord Chigi, can you hear me? David, can you hear me? Yeah, okay. Look, I tell you what you were saying earlier on, how we're talking about the local communities being involved, but practically speaking, how can communities be empowered to take part in the response? How do the big international organization and national executives empower and encourage and contact the local communities to make sure they're the people? I don't think we want it. Some governments are questionable. They may not distribute the funds, if they get funds, equitably or as they should or responsibly. How do the big organizations get to the local communities?
Well, can you hear me, Mike?
Yes, can hear you now.
Oh, that's good. Well, you've asked several questions there. Many, and they're all very, very interesting and complex and not easy to answer, but I'll do my best, of course. You talk initially about the money, which is the key issue to trying to drive these things forward. Yes, there are issues about money not going to the right places, and the big organizations do handle that. It's quite common, for example, that DFID, the Department for International Development of the UK, to overcome that problem, have put the funding that we provide, the taxpayers' money we provide to help countries in developing circumstances, they put it through to the actual organizations who are delivering on the spot, and therefore avoiding the administrations, the establishments that are, if we like, suspect in their ability to handle these affairs. And that has worked very successfully, particularly, I know for a fact, in Malawi and in Uganda in the past, by literally working with other agencies who are respected and can deliver to the people in need in the remote areas particularly. And this concerns, I know from experience, delivering vaccines to villages, just as an example. So there are ways, and the organizations who administer the delivery of aid funds to developing countries are very experienced at this, and they can cope with it. Not necessarily every time, but they're aware and they do handle it. That doesn't answer the problem which was raised earlier about the shortage of money in the World Food Programme. That doesn't answer the problem of the fact that Gavi, which is the international organization supported by Bill Gates in developing vaccines, the fact that they're short of money. There has to be this international will and commitment to provide the sort of funding and finance and the mechanisms to deliver it where it's needed. That's absolutely important. Now, the second question, which is very much related, and that's about, I suppose I'd put it in my, being a parliamentarian, I would relate it to strengthening democracy, strengthening the organizations and mechanisms within a society to enable the people to hold the government agencies at any level to account. That is a key factor. It has to be transparent, and it has to be accountable. Now, as our colleagues here talking this morning from various African countries know, the concept of having your leaders at local level answerable to their community is sort of part of their DNA. It's gone on for thousands of years. It's nothing new, and they don't have to wait along until some shiny, glossy version of Western democracy pops up on the doorstep. People are people. They understand and know how that they have the right to control their lives. It's basically, I think, a problem of communication, a problem of education, and a problem of the developing systems which have the capacity to deliver to their people at every level, whether it be the village, the township, or the city. And that takes time, and that's not so easy, but it's not by any means out of reach.
Okay, can I ask you a question? and it's something to which I referred earlier on. And Brendan Howland, I'd be interested in your reaction too. When this narcissist in the White House did what he did in saying we're going to cut off funding to the WHO, I was amazed at the temperature of the reaction of leaders around the world. Why did Boris Johnson, well, okay, he was in hospital at the time, but why didn't the leaders not say, you cannot do this, you appalling creature? You know, I mean, I know our Taoiseach, Brendan Howland, Simon Coveney did very.
Can I come in here on this one very quickly? You asked me first. Can I come in now? Hello?
Go ahead.
Thanks. I think the most interesting reaction that I picked up last week was that on this announcement from Trump, the reaction from China was to say they would make good the difference in the payments to the WHO. That, as an international political move, I thought was fascinating. Now, I can't speak for what Trump does. I mean, he's unbelievable. It's all about distraction politics, and Brendan and I both know this very well. We've seen it before. And the worrying and the sad, tragic thing is that there is an element of local right-wing percentage of American townships, populations, whatever, who get the opportunity to support Trump in the media, which really is quite frightening in the longer term.
Well, he's sorry, I'm interrupting you, David. I didn't mean to, but he's using his nightly briefings, the Rose Garden and so on, as an electioneering ploy. He's supposed to be giving information on what the virus is doing, and no, it's elect me. I'm doing a great job, aren't I? It's pathetic. Brendan, can I have?
It's a tragedy for the world. It's a tragedy for the world that the United States is led by an ignoramus at this time of real need, and everything he does is damaging to the solidarity we talked about. So we can only just hope that he will be replaced in November. That's all we can do. And look with dismay with the America that becomes more and more isolated and isolating itself from internationalism. But David makes a very important point. There will be a new world order after this pandemic. Things won't be the same. And the influence of China will be a very interesting thing to watch. You saw in Italy that when certainly the appearance of the support and solidarity from the European Union for a colleague member state was less than the instant support it got from China.
Yeah.
And China is playing very important politics in all of this. So I think thinkers in America, even in the ultra-right, will have to determine whether America wants to be an isolationist country again, pre-Second World War America that has little influence across the globe. And I think that will be something that thinkers in politics in America will resist.
May I go to, thanks Brendan, may I go to Martha Carua? Martha, we'd be very interested in hearing your reaction to precisely what David has been discussing as someone who is a former Minister for Justice in Kenya. And we'd love to hear what are your thoughts? You mentioned China earlier on, but what are your thoughts on the move by Donald Trump? Martha?
To reopen, I missed the question. The move by Donald Trump to reopen, Ali, or?
No, sorry, I'm sorry about that. No, the move by Donald Trump to cancel funding by America of the World Health Organization.
I think that was most unfortunate, and coming at this time. It was mentioned earlier, and I agree that this is a time for solidarity, not individuality. And so long as this pandemic is not handled in any corner of the globe, it will still rebound to the rest of the world. So it was not the right thing to do. And America ceded its leadership to Russia in that one, because a week later, Russia says they'll fund the World Health Organization.
Martha, can I ask you, did you feel that it was extraordinary, as I did, that world leaders did not scream in protest at that gesture?
I think, yes, there was the issue that world leaders did not respond, but also we have to remember every leader is busy minding their front, because this pandemic has affected everyone.
Okay, can I very much. May I move on to questions that we have sent? I think we're going to run just slightly over time, and I gather it's with the acquiescence of most people, so I hope it's not difficult for you participants. Let me ask, Jacob asks, is the East African community effective in the regional response? I'm going to throw two questions out here. From Michelle Mulhern, how can testing be extended to get throughout Africa? Would anybody like to take either one or both of those questions? Is the East African community, okay, well, let me pass on. Nobody seems to be willing. I didn't see any willing takers or going up to either.
Martha.
Okay, Martha, did you, Martha? My apologies, I just didn't see that. Okay, please go to whoever did say they would.
Yes, I don't think that the East Africa community has the capacity at the moment to respond to COVID. If you look at the responses by the East African country, they are individual responses. In Tanzania, there is no restricted movement or lockdown at the moment, while all the other countries are having that. So it is uncoordinated. And I think there's an opportunity for East African leaders to build the capacity of the East African community to respond to situations like the one we are in. Because if there's not uniformity due to our proximity, any work, good work being done by other countries can be messed up by just one.
Thank you very much. Can I go back to Professor Naz? Naz, let me ask you this. In Uganda, the lockdown and the effects are being felt. Can you envisage a breaking point? You've probably seen around the world where people are saying enough, enough, I don't want to be locked down anymore. Can you foresee a breaking point in Uganda? And would you see it being keyed in by the food shortages? Does it worry you?
Thank you so much, Mike. Indeed, it worries me. Uganda has done very well to put a stop to the escalating COVID crisis because we've kept the numbers at around 55, 56, that's the numbers. But I can assure you, if there's no proper intervention on food distribution, if there's no proper intervention on distribution of medicines, and the economy, especially for the rural poor, this can't continue. Something has to be done to make sure to mitigate these effects. For example, if there's any kind of country, the donor country or IMF or World Bank to really come in, it would come in to fill in those gaps. If that's done, then we can move on. If nothing's done, definitely there's going to be a breaking point.
Okay, thank you very much. I have a question here for Sally Hayden. This is from Kevin, who asks you, Sally, what measures are African governments taking for large populations of refugees and asylum seekers in establishing more and safer refugee camps? Are you aware of any, Sally?
Yeah, I mean, I think the measures are pretty much the same as everywhere else, like stop inward and outward movement, make sure that people are practicing social distancing and distributing soap. That's not always governments, that's charities as well, like distributing soap, water. Lots of people wouldn't have running water, so just making sure they have those provisions. The big thing that I'm hearing from refugees, which I've heard from Rwanda, Sudan, Kenya, Uganda, and Libya so far, and possibly more, is that they're concerned because particularly the UN and the UN Refugee Agency follows quite strict security procedures. And so they are feeling like aid or like people aren't monitoring what's going on in the camps, and also that they're at risk of kind of being forgotten, or that they're being left without without anyone to turn to when they have problems. And so again, that's almost the bigger risk that certainly I'm hearing from them, is just that they feel like they're being a bit abandoned. But again, that's something that, in the short term, it's probably okay, but in the longer term, it's going to become quite a bad issue.
Thank you. Thanks very much, Sally. I believe I have been remiss in not raising the issue that's been raised by Bandy from the Mary Stopes Foundation. What concrete actions can governments take to help women? Women are among the most vulnerable people in this for everything. The pregnancy-related deaths, for so many reasons. Many of them are the people who go out to work, they're looking after children. So are there concrete actions being taken, or can they be taken? I don't know who wants to take this question. What concrete actions can governments take? Is there anybody who'd like to volunteer to answer that?
Maybe
Sally, back on.
Yeah, if it's worth me just saying, so I think it was yesterday or the day before the president here, we were talking about women dying, trying to get to hospitals. The president here made a speech where he said that he's going to, from now on, visibly pregnant women are allowed to travel to hospitals. And then he kind of made a joke that, you can't stuff your stomach to try and get there. And rights groups and women's groups have responded to that, saying, like, women aren't just vulnerable when they're, 9 months pregnant. Like, you can miscarry at any time, you can need care at any time. Beyond that, there's also an issue, certainly here, of domestic violence. And that's growing when families are under pressure, people are stuck at home. And I know that they told me 4 or 5 women, just this one group has documented at least 4 or 5 women being killed so far because of that. So again, I think it's something that, I'm a journalist, like I said, I don't know the policy, but it's something that is really, really pressing.
Okay, is Jennifer asks a question, which is quite interesting, about the role of the African Union. Is the African Union taking a leading role? Can anybody answer that?
I can say something. Oh,
yeah.
Yes, now they not yet visible enough. Uganda, Africa Union, they have set up the African CDC, Centers for Disease Control. I know they are struggling with the funding and all sorts of things, but having the setup itself was good news. But on whether they have actually done anything that we can feel in Uganda, in West Africa, or whatever, not as yet. But having that setup was very good news.
Can I ask, generally, extending testing, what are the obstacles to extending testing? I suppose the equipment, lack of equipment would be a big one, wouldn't it, really?
That's the one.
It is.
Yeah.
That's the one.
In terms of the volume, I was interested in Dr. Aluga talking about 1,000 tests being a mass testing. Ireland, with a population of 4.5 million, we're currently doing 10,000 tests a day. And our aim is to get it up to 15,000 tests a day. And it has proven challenging to get to that level. Is there, I was wondering from Dr. Luga's perspective, is there any potential for significant mass testing in African countries?
I think Naz wants to come in there. Do you, Naz? I'm not sure that Dr. Luga is with us. Naz, yes?
Yeah, yes, I can assure you, as the main limitation is actually funding. Continued testing, large number of tests definitely would do a big service. It would be one way to really fight back. But the question is really funding. And then also in Uganda, we've tried to look at the we've now targeted certain targeted groups. For example, everybody entering the country, through trucks and whatever. We are testing them. At least this is happening right now. At the moment, what you can afford. But if there were resources, definitely one would love to get into large-scale testing.
Okay, well, Professor Nas, thank you very much indeed. I think we're going to close it there. And I think from what I was able to gather from the whole thing, I think some of the main points that came out of it, one of the first ones that was raised by President Higgins at the very beginning, cancel the debt. That seems to be logical, it seems to be charitable, it seems to be practical. The community engagement to make sure that the community has a major say in any applications or lockdowns or whatever else that is going to be imposed by government. And it's obvious there's an urgent need for the rest of the world to be conscious of their responsibilities towards their fellow man and woman in Africa. So look, may I just say thank you very much. I don't know.
Mike, if I may.
Yes, sorry.
Yeah, if I may, I would like to issue a call of action to our fellow youths out there, Africa and beyond. We understand that the suddenness of this situation may have taken some of us aback and has probably made us even more vulnerable to vices and bad decisions. However, we implore you all youths to look at the bigger picture and ponder more on the future that we've envisioned for ourselves rather than dwell on the present. We are unfazed basically by this obstacle on the path to our great future, and we will give idleness and negativity no room in our minds. So this is the time for you to take action. You can do many things to keep your community safe, including staying informed, fighting misinformation, doing your part to flatten the curve, and most importantly, letting your friends know what they can do too. So you abstain from spreading false and misleading information on social media. Do not resort to crime to make ends meet. Join the fight by volunteering in your immediate communities. Get engaged in constructive programs like free online educational courses. Build your personality as well as your professional profile, even at a young age. And just as collectively as we fought the Ebola virus by following health and safety directives, we should pay close attention to information and updates as issued by the health services on the coronavirus, and we can beat it. And in the face of increasing government corruption, we also encourage external organizations that are donating to African countries to make the extra effort to procure these materials themselves and deliver them directly to independent community foundations so as to eliminate the government middleman factor. So we encourage youth, and that which does not kill us only makes us stronger. And just as the great physicist Marie Curie once said, nothing in life is to be feared, it is only to be understood. Now is the time to understand.
Thank you so much for that very strong contribution. And I think that draws us to a close. And we would love to see President Trump being dissuaded from his silly action as well.
Working on it.
Can I say thank you so much to all of you for taking part, and let us hope that our little conversation this morning will lead to something positive. That is all we can hope. Thank you so much, and very nice to hear from and to meet you all.
Thank you very much.
Cheers.
Thank
Thank
you so much. And everybody.
Thank you.
Thank you.
Thanks, Kieran. Simon, thank you very much.